at a much greater rate among individuals now than we did against the original alpha. So bottom line is, when you're dealing with a variant, you don't get the kind of protection that you would have hoped to have gotten from a previous infection. Regarding the issue of vaccinating people, there's no doubt when you vaccinate someone who has had an original infection and who is recovered, not only do you increase the depth of the protection, not only do you increase the duration, but you also increase the breadth of it so that you cover not only the original, but the variants. And that's the reason why the recommendation still holds, that even though you've been infected previously, in the context of variants, it's a good idea to get vaccinated anyway.
Next question.
Go to Rachel Cohrs at Stat News.
Hi there. I had a question for Director Walensky about, whether the CDC is tracking COVID-19 booster shots that may be authorized by physicians.
Thank you for that question, Rachel. We are just starting to gather data and get data on, and we can discern between people who have gotten second and third shots. We are trying hard to encourage people to report on the safety side. If people have taken the initiative to get their third shot, again, not yet recommended, but we have the capacity and are looking at those data right now.
Dr. Fauci, anything to add there?
No, nothing to add. She said it very well.
Next question.
All right, we got to do last question. Let's go to Zeke at AP.
Thank you all for doing this. I was just following up on Jeff Mason's question earlier for you, Jeff Zients, on the additional requirements. It seems what you're trying to do here is impose some sort of cost on people who are unvaccinated as a sort of the stick there to sort of get them to roll up their sleeves and get the shot. So why isn't the federal government going further on some of these, whether it be proposing mandating vaccination requirements for travel across the federal workforce, for instance? How far is the administration willing to go to sort of turn up the pressure on the unvaccinated to actually get shots?
Well, Zeke, I think we've taken significant steps here to make it difficult to come back to work, or more difficult to come back to work if you're not vaccinated. There's so many reasons to get vaccinated that we've talked about to protect yourself and to protect your loved ones. And it's also a really straightforward way to return to work. So for all federal employees, the path back to work, if you're vaccinated, is straightforward. If you're not vaccinated, or you're not willing to attest to being vaccinated, then we're doing the right thing to protect the workforce, to protect the individual, their family, and their colleagues, which is rigorous testing, social distancing, and masking. There are mandates at the VA for vaccination for their healthcare workers, their doctors, and their nurses and other healthcare providers who take care of our veterans. That's consistent with a lot of health systems across the country, and a growing number of health systems that are requiring vaccination for their healthcare workers who are on the front lines. As I said earlier, the Department of Defense is looking into how and when they'll add COVID to the list of mandatory vaccinations for active duty military. At the same time, we will continue to look across the federal government at other areas where requiring vaccines, everyone be vaccinated, may make sense, particularly in the healthcare setting. And we're seeing it in the private sector. More and more companies are coming up with systems that are modeled after our system or similar to our system, or requiring vaccinations across the board. You're seeing it at universities, you're seeing it at health systems. So I think that this requiring of individuals to be vaccinated in order to come back to work or to go back to school is a growing trend, and makes a lot of sense given that we're going to beat this pandemic by getting more and more people vaccinated. I want to thank everybody for today. Look forward to the next briefing. Thank you.